All right, everybody. Now we're going to move on to chapter 9, which are the joints. Again, this is a chapter, not as much as the last one, but you don't need to know every single thing that's in your chapter. So I'll highlight the stuff that you do need to know and try to point out some of the stuff that I don't want you to focus on too. Okay, so joints are classified in kind of two different ways. So how movable they are. So fixed, meaning they don't really move at all. Semi-movable, meaning there's just a little bit of movement, and freely movable, meaning they can move a lot. And that's kind of the category that we'll focus on for the most part. They can also be classified by the material that binds them together. So you have fibrous joints, cartilaginous joints, and synovial joints. And these two categories kind of go hand in hand. So fibrous joints are going to be fixed, cartilaginous joints are semi-movable, and your synovial joints are your freely movable. All right, so fixed, meaning they're bound by fibers. Like I said, those are your fibrous joints. Another word for that is synarthroses. So don't get that confused with your synovial joints. A fibrous joint is a synarthroses. So an example of that is the sutures in your skull. So it's considered a joint, but there's really not going to be any movement in these sutures. So your semi-movable joints, they're going to have cartilage. Another word for that is your cartilaginous joints or your amphiarthroses. So an example of that is your symphysis pubis. So there's a thick piece of cartilage here between your two pubis bones. Another example of that's the manubriosternal joint. So where the manubrium meets the body of the sternum, that's a cartilaginous joint. And your intervertebral discs are also cartilaginous joints. And then you have your freely movable ones. So those have a fluid-filled joint capsule, and that's filled with synovium, and that's why they're called synovial joints or diarthroses. And like I said, these are the most numerous. They're the most versatile. Kind of your knee, elbow, shoulder, all that stuff are all synovial joints. So that'll be the main focus of our chapter as a whole. Okay, so I'm gonna drop down to this slide for a second. This is just a zoom in on everything and all the different parts that make up a synovial joint, but I went ahead and put the definitions for all this stuff on this next slide. So your joint capsule. So that is this part here, and that's around the whole joint. And so that comes off the periosteum, that outer covering of the bone. You have your synovial membrane, which is the membrane that secretes synovial fluid and it kind of keeps the joint lubricated. So that's this darker purple, kind of the very inner portion of the joint capsule. Your joint cavity is just the space between the two bones. So that allows for that freedom of movement. It holds the synovial fluid. And like I said, that's what lubricates the joint. And it also nourishes the cartilage. It kind of is how our cartilage gets nutrients. And it has our white blood cells that will help get rid of debris. Your articular cartilage, we talked about this in the bone chapter. Remember that can also be known as hyaline cartilage. This is that lighter blue covering here, and that's so that the joints don't have quite as much friction. And then ligament. A ligament is going to connect bone to bone. So it's pretty tough connective tissue. And like I said, it's bone to bone. So we talked about tendons in a couple chapters previously, and that is what connects muscle to bone. Ligaments, this outer part here, I think, look, bone to bone, no muscle in between. There's also a structure known as a bursa, and you can't see it. There's not one in this picture, and that's partly because not every single joint has bursa. There's small sacs that also have synovial fluid. Sometimes I describe them to my patients as looking like a Tide Pod. If you've ever seen one of those, and in a sense, it's just there where there's going to be muscle or tendon that's near the bone itself. That way, that muscle and tendon aren't rubbing directly against the bone, especially when it's in an area that may have a tubercle or something that could kind of point out and cause a lot of friction. Okay, so first question, most of the joints in the body are A, fibrous joints, B, synovial joints, C, cartilaginous joints, or D, synarthroses. And the correct answer is B, synovial joints. Remember, this is the most numerous, also the most versatile. They outnumber fibrous and cartilaginous joints by quite a bit. And remember, even though it's syn and synarthroses are the name for fibrous joints. The other name for synovial joints, if you remember from the beginning of the slide, is diarthroses. Okay, so within synovial joints, there's also subclassifications kind of based on how they're structured. So the pivot joint is the first one we'll talk about. And so that allows your bones to rotate or pivot, which makes sense. And they're kind of all, in a sense, named, or most of them are named for what they allow the joint to do. So the best example of this is your atlas and axis. So you see the dens coming up from the axis, and the atlas articulates with that so that you can get that rotation. The hinge joint, this will allow back and forth movement. So your elbow or your humeral ulnar joint is a good example of this. So your elbow, pretty much, you can straighten it and you can bend it back up with that hinge. A gliding joint. So this is typically where flat bones are found that can kind of just slide next to each other. So your tarsals or your ankle bones and your carpals or your wrist bones are good examples of these. Ball and socket. So the best example of this is the shoulder. The hip is a good example of this as well. And this allows for a whole bunch of movement. So you have the ball fitting into the socket. So that ball can kind of rotate all over the place in the socket, and you can pretty much move it any way you would like. So like I said, a good example of this is your shoulder joint. So you see your humerus has the ball, which fits into the scapula in what's known as the glenoid cavity. And so that allows the shoulder to kind of move all over the place. So one thing to keep in mind is in joints in general, there's kind of a trade-off between mobility and stability. So a joint that really can't move much, such as your hinge joint, there's not really a whole lot of degrees of freedom. That's not going to have, I mean, it's going to be a pretty stable structure. There's not a high chance of dislocation or having issues with the stability factor. Your shoulder, on the other hand, because it can move all over the place, it's not nearly as stable of a joint. So there's like I said, there's a trade-off between mobility and stability. All right, a saddle joint, it's called that because you see the shape here is almost like a horse's saddle. And so it can allow a bone to move back and forth as well as side to side. So not quite as much movement as a ball and socket joint. And we don't see this one super often. The thumb on its wrist bone, the trapezium here, is a good example of this. But this is not a common joint to see. Again, not the most common joint, but a condyloid joint. This will allow flexion extension as well as side to side movement. So not quite as much freedom as a ball and socket joint, but a little bit more than just back and forth. So an example of this is where your forearm meets your wrist bones here, where your radius and your scaphoid meet. Again, not a super common joint. Know what it is, but don't get overly concerned with these two. All right, question 2. I hope you guys can get this one. Which joint offers the widest range of motion? A, hinge joint, B, gliding joint, C, condyloid joint, or D, ball and socket joint? So we just talked about this one. So D, ball and socket joint. Remember that hinge joint is only back and forth movement. The gliding joints are more of a sliding movement, and that's your wrist and your ankle. The condyloid joint will allow that flexion extension in side to side, so a little more than a hinge, but not as much as the ball and socket. And that ball and socket pretty much gives you a range of motion anywhere you want to go. And so remember, we also talked about the trade-off between mobility and stability. So the ball and socket joints are going to be your least stable because they can move so much. All right, so movement of our synovial joints depends on the shape of the joint, like we just talked about, as well as the involvement of the nearby muscles, tendons, and ligaments. So even though a joint can move, a joint may be allowed to move in a certain way, we still need the muscle, tendon, and ligament structures to allow it to do so. All right, so we're going to go ahead and talk about the different movements in the body and how they're named. I think even though it's kind of silly, a good way to really get this ingrained in your memory is if you do the movements yourself. So in here we have the example of our elbow. So flexion, that means we're going to kind of pull it towards the attachment point. Extension, you're straightening away from the attachment point. And then this shows your wrist here. So it talks about hyperextension. Don't worry about that too much. That's just kind of when your joint extends past where it really is kind of the normal. So we don't see that in a ton of places. Some people can do it with their wrist. You see people can do it with their thumb. Some people's knees and elbows can drop back into hyperextension. But I want you to focus on flexion and extension. All right. For the ankle joint, flexion extension is a little bit different. We call it dorsiflexion and plantar flexion. So dorsiflexion is when you pull your ankle up towards you, whereas plantar flexion is when you push down, kind of like a gas pedal. Okay, abduction and adduction. People get these confused a lot because they sound very similar. The best way to remember this is that adduction is going to be towards the body. We're adding it to the body. And abduction is the opposite. So abduction is going to be away. So be really careful with these two just because they sound very similar, but always remember add to the body. Add is going to be towards the body. Okay, circumduction is basically making a circle. So the only joints that can really do this are our ball and socket joints. And I guess some of the saddle joints and a couple of them can do a similar to a circumduction. So that's just that circular movement. Okay, internal and external rotation. Internal rotation is going to be turning in towards the midline, while external rotation is going to be rotating out away from the midline. Supination and pronation. Supination is going to be turning the palm up, or if we're talking about our total body, going into supine is laying on your back. So the one way to remember this one is I would like some soup. Turn your hand up to get your soup. And then pronation is flipping the palm down, or when we're discussing our whole body, you would be laying on your stomach, what's known as the prone position. So supination is palm up, pronation, palm down. And not just your arm does this, but this is the best example and the easiest to illustrate. All right, inversion and eversion, this is kind of specific to the ankle. So inversion is kind of pulling your ankle in towards each other, and the big toes go towards each other. Eversion is going out or laterally, so your pinkies are kind of going out. Protraction and retraction, we can do this with our jaw, we can do this with our neck. So protraction is when we push out away from the body. Retraction is when we pull it back in. So think protraction is kind of sticking your jaw out. Retraction is almost kind of pulling your teeth back in, or with your neck kind of doing a double chin. All right, question 3. Pronation describes which movement? A, the bone spinning toward the body's midline. B, foot movement, turning the sole medially toward the other foot. C, movement turning the palm upward. Or D, movement of the body part away from the midline. the movement turning the palm upward, and I realized I accidentally put pronation. So I'll fix that when in your slides that I upload. This should be supination, supination. So this describes supination, movement turning the palm upward. Pronation would be turning the palm downwards. So bone spinning towards the body's midline is internal rotation. The sole or the big toe going towards the other foot is inversion. And remember, movement away from the midline is abduction. All right, we're going to highlight some of the most important synovial joints here. I think your book goes a little bit more in depth than you need to know, so I'll highlight a couple of things here. One of the things that I wanted to point out quickly, just because we talked about it earlier, is the bursa here. So that's these little blue guys. So those sacs are to make sure that all the stuff that's here in this small area and all the bones here don't run into each other and cause a lot of inflammation. The shoulder is an area where these can oftentimes be pain generators when they get inflamed because they take up more space than they should. So when we talk about our joints, a lot of times we call it the shoulder, the elbow, the knee. They also are named by their anatomy. So your shoulder is known as the humeroscapular joint or the glenohumeral joint. You definitely need to know that it's a ball and socket joint. So I also want you to know the shoulder is the most likely to get injured or dislocated because of how much movement there is. There's a whole bunch of ligaments that support it, and there's a lot of muscle that supports the shoulder as well. But because it's such a mobile joint, it is an area that can tend to have issues and have subluxations and dislocations. So that's the main thing to remember. We have a lot of movement, best movement of any joint in the body, ball and socket, and it's because it's the best movement, it is also the most prone to dislocation. Your hip is another ball and socket joint. So it has a lot more ligament and muscle around it. So even though it's pretty mobile compared to the shoulder, it definitely does not move as much, and it's not quite as prone to the instability issues as the shoulder. So no, it's a ball and socket joint, but other than that, you don't need to worry about the hip too much. Part of the reason that it's stable is that this femoral head fits into this deep socket here. It's covered by ligaments right now, but there's really good connection between the two. So it's just a much more stable joint, even though it's a ball and socket joint. Your elbow, definitely need to know that this is a hinge joint. It has a really large joint capsule that kind of surrounds everything here, and including, so you have your ulna that creates the hinge there, and you also have your radius, and that joint capsule encloses both of those things. So the elbow is pretty stable. It's also known as your humero-ulnar joint. And the main thing you need to know about the elbow is that it's a hinge joint. All right, our knee. The big thing here is that it's the largest and most complex joint in the body. I don't want you to memorize every single little structure, but you should be aware of them. The two menisci here, your lateral and medial meniscus, those are pads of cartilage that help give it some space and also help with the stability between your femur and your tibia. And there's 4 different collateral ligaments, your ACL, PCL, LCL, and MCL in the front, back, left, or sorry, not really left, but lateral and medial. And so they call the lateral collateral ligament the fibular one here, and the medial collateral ligament the tibial one here. But the main thing to know is that it's got a lot of ligamentous support to try to keep it stable. But I don't want you to get too caught up in knowing everything. I don't need you to know all the ligaments and what they restrict and that kind of stuff. You should know that the meniscus help absorb shock and help with some stability, but other than that, don't worry about it too much. All right, last question here. So which joint is most likely to be dislocated? Remember, the most mobile are the least stable. So the correct answer is your shoulder. So remember, the hip is a ball and socket, so it has a lot of freedom of movement, but it's got a much deeper socket and it's got a lot more muscular support. And then the elbow and knee aren't really prone to dislocation. Your knee obviously can have a lot of injuries, especially when you think of the sports side of things, but not necessarily an unstable joint. And that is the end of our joint stuff. So really make sure that you know the different types of joints. Make sure that you know the different types of synovial joints. And then remember those key highlights from our synovial joints that we just discussed, but really focus on kind of the first 2/3, 3/4 of this chapter.